Welcome to Lead Up, Leadership Gwinnett's podcast, dedicated to showcasing initiatives that truly impact our community and the incredible leaders behind them. I'm your host, Logan Serrano, Director of Marketing and Communications with Leadership Gwinnett. Today, I have joining me Jennifer Hibbard. She's the Chief Executive Officer at Viewpoint Health. She's also Leadership Gwinnett's Management Team Chair and a graduate of the best class ever, class of 2015. Welcome, Jennifer.
Hi there, Logan. Thank you so much for having me. I'm excited.
A little bit about Viewpoint Health. They're a community behavioral health center that provides services to individuals who need treatment and support to cope with mental illness, substance abuse, and intellectual and developmental disabilities, and specifically to those who are from under-resourced communities. So Jennifer's actually worked at Viewpoint Health for over 19 years. She began her career there as an intake clinician at one of their mental health outpatient centers. So pretty cool. She's been there for a while. Jennifer's an absolute rock star. She's so involved in her community. She's been on the Gwinnett Coalition Board. I think she currently still is. She's part of Rotary and tons of Leadership Gwinnett work. We keep her very busy. And she's also a recent recipient of the Gwinnett Chamber's Pay It Forward Moxie Award. So I'm so excited to have her joining us today to talk with us a bit more about this incredible resource in our community. So Jennifer, we're going to dive right into it. Can you tell us a little bit about yourself and how you did come to be the CEO at Viewpoint Health?
Absolutely. So I actually moved here from Texas. I was originally from Texas, and my husband and I had been married for about a year, and we wanted a different opportunity. Neither one of us had ever left Texas, and so we decided to come to Georgia, to come to Atlanta. And I just was interviewing for jobs, and this was my very first job out of grad school. At the time we were called Gwinnett Rockdale Newton Community Service Board, and that was in 2003. And I got my job as an intake clinician in Conyers, and I had that position for about 3 years, and then a couple years as a team lead for the child and adolescent program. And then I had various opportunities to move around to different departments, to different programs. I did some administrative work. And it was about 9 years ago that I had the opportunity to serve in this role as the CEO. And we had some leadership changes. Our CEO, who is also a Leadership Gwinnett grad, Frank Berry, was asked to go lead the State Department of Behavioral Health. So that created some leadership change at our organization, and I ended up being selected by the board to serve as CEO, and I absolutely love it. I want to do this work for another 20 years. This is my passion. I love the community that I serve. As you can tell by the work that I do with Leadership Gwinnett and Rotary and the Coalition, this is my home, and I just love being here.
And we are so lucky to have you. Viewpoint's so lucky to have you. Everywhere that you have a piece of, you make such an impact there. So we're so appreciative of you. So tell us a bit more about the mission of Viewpoint Health and who you serve specifically. I know I kind of mentioned it a little bit, but can you tell us what kind of individual comes to Viewpoint Health?
Absolutely. So as you said in the intro, Viewpoint Health is a community service board. So there's actually 22 community service boards across the state. So every county is covered. We've got a safety net network. And so Viewpoint is charged with serving the individuals in Gwinnett, Rockdale, and Newton counties. And our mission is building healthy lives and healthy families through high quality comprehensive care. So the individuals that come to us are individuals who have no insurance and might be low income. They might have Medicaid and Medicare, but they are really under-resourced. And so that's really our charge. When we say safety net, that's what we mean, like the people that would not be able to access care elsewhere, they come to us. And part of our vision is high quality comprehensive care. And we all believe that that is what is so important, is that even though our services might not cost the individual who's coming to us, if they are low income and on our sliding scale, they don't have a fee, we still want the services to match any paid service, any high quality other service that's out there. So we have highly trained clinicians, and we use evidence-based practices to make sure that the individuals that come to us get the outcomes that they need to live a life of recovery.
What a fantastic resource for people that we have right here in our community. So maybe this is a question that I did not include, but how is it paid for? Is it subsidized? Could you go into just briefly like how it's funded?
Yeah, we have multiple fund sources. So our primary fund source, just right at half of our funding, comes from the State Department of Behavioral Health and Developmental Disabilities through the legislative appropriations that we get. So it's state tax dollars that we bill, just as we bill Medicaid. We bill the state at the same Medicaid rates that we bill Medicaid for each service that we provide to those individuals. And then we bill Medicaid and Medicare. We also have a contract with the VA. So we do serve veterans. We have a few hundred veterans that we serve. They have to go through the VA to get authorization because that's their payer, but then they come to us for services. And we really want to be able to offer that care to veterans that can receive their care right here at home, as opposed to having to go into the VA in Atlanta. So we really like to offer that. And we do have clinicians that are trained specifically for veterans, and we have veteran-specific groups for fellow veterans. So that's our primary funding. We also have federal grants, and then we have private contracts too with even like local law enforcement. We have private contracts to provide clinicians to other partner organizations.
That's so awesome. And I didn't know that piece about veterans. That's really cool. My dad's a veteran, so that means a lot to me. So
we really care for our veterans.
yeah, I love that. What services does Viewpoint provide? I know you do some mental health, substance abuse, but what does that look like?
So we offer a full continuum of care. So when you think about going to get mental health or substance abuse treatment, you probably think about individual therapy, group therapy, going to see a psychiatrist. We provide all of those services at our outpatient clinics. We actually have 5 outpatient clinics throughout our 3 counties. But then we also have community-based services. So sometimes it's hard for individuals to come into the clinic, so we go to them. So we do have the same services, assessment, crisis services that we can bring into the clinic or into the home. And then we also have more specialty services like day programs, where sometimes individuals that with severe mental illness, their symptoms have really compromised their ability to care for themselves. And a more intensive program like psychosocial rehabilitation is needed, where they'll come every day and they'll learn life skills and budgeting and even job skills, because our goal for everybody is to live a life of independence and recovery. And so some of our more intensive services help them towards that. We also have residential services, so we do operate several group homes. We actually have 3 apartment complexes for individuals who are struggling with homelessness and mental illness. And we also have 3 crisis stabilization units. So if somebody is in a mental health crisis or in need of detox from substances, we've got an adult crisis stabilization unit here in Lawrenceville. Then we also have an adolescent unit that happens to be located in Decatur, because that unit serves the whole state. We really serve kind of the younger kids, more middle school age kids that also have autism. So they might be in a crisis, but they have a diagnosis of autism. And that crisis unit is located in Conyers, but we do serve the whole state. We're the only one.
Wow.
It's a lot of services to try to cram in there. And I know I've missed some, but pretty much anybody that is coming to us that they probably have really, really high needs, and there's not anybody that we can't serve. So no matter how high the need or how severe the symptoms, we've got a service for them.
That's incredible. And you guys are truly meeting people where they are, especially just looking at the breadth of services and the residential, the group, the in-clinic. So, I mean, it's incredible. I honestly had no idea this even existed. So this is amazing.
Yeah, I
Can
like
you,
to say we're like the best kept secret, but we don't need to be a secret. We
I
need people to
know.
know. So I appreciate you having me on today so we can spread the word.
Definitely. I love being able to share this with our constituents. So can you share a story of an individual whose life was changed because of Viewpoint Health?
Absolutely. So we have the most amazing stories of recovery, and I would love to share one with you. This is from our annual report, and this individual gave permission for us to share this story. Is it okay if I just read it? Because I want to tell it in their words.
I love it. I've read this beforehand. It's incredible. Share, please.
Okay. So this individual, female, says, I am a person in long-term recovery. It's been 2.5 years since I have used any mood or mind altering substances. After 7 institutions, 3 overdoses, being on life support twice, and losing my mother to her addiction, I had no hope. It was not until I had the Department of Family and Children's Services open a case on me out of concern for the safety of my 2 children that I decided I wanted to try something different. It is a family disease for me. This case came 20 years after the same county responded to tips that led to the removal of me and my 2 siblings from our parents' home. I had so much hate in my heart and said I would never be like my parents, yet here I was. I always knew in the back of my mind when I did decide to get treatment, I would go through Viewpoint Health. Over the years, I had been in outpatient services, but had never truly participated in my own treatment. I had been in the crisis stabilization unit for detox on numerous occasions. I had nothing but positive experiences with them and had never felt judged, which is so important to people struggling with their mental health. I made several appointments at Gran, but never showed up. However, I made it this time after a week in the crisis stabilization unit. I completed 28 days in Gran recovery and put in an application to go down the hill, as we call it. That's our substance use residential apartments.
Oh,
Yeah, this was a somewhat new program at the time, and it was an extension of Gran Recovery, which is our residential treatment facility.
okay.
This is where I could learn to be self-sufficient, to continue to get healthy. Once I was given the opportunity to go to substance abuse residential and break down the reason I used in the first place, I finally began to heal. This was the real game changer for me. She really appreciated classes where we learned about the science of addiction. I can get behind science, and I've been fascinated with anything related to the brain since I was a child. During my 18-month stay, I was able to regain my driver's license, save up and buy a car, secure joint custody rights of my children, and do a lot of work and therapy around my mother's death. I also began the process of continuing my education. I am proud to say I was one of the first graduates of the substance abuse residential program, and by the time I graduated, I had also earned my certification to be a certified peer specialist for the state of Georgia. I have raised my credit score 140 points, and I never thought any of this would be possible. My hope is to have my own home and for me and my children in the next year. This is all a dream come true for me. The amount of things that I accomplished in my first 2 years of recovery has left me feeling so empowered. I'm proud to say now that I have the opportunity to wake up every day and go to work in a crisis walk-in clinic. I see people who are just like me, and I want to empower other families in my community to break the cycle of addiction by providing resources. I went from being terrified that my name would be ran to having letters behind it. I went from feeling that I had no voice to advocate for myself and others, even when my voice shakes. And I went from frequent detox centers to working in one for the state of Georgia. I went from using my siblings when they were not in jail to recovering with them. Today, I have 4 family members in recovery. Today, I have an amazing relationship with my children and a healthy co-parenting one with their father. Today, I focus on what is right with me instead of what is wrong. Today, I live by spiritual principles and I practice vulnerability. I am still enrolled in services through Viewpoint Health, and I don't see that changing anytime in the future. I have a wonderful team of people around me that I trust. I have a community of people that are definitely my family. Now I love myself and others. I am evidence that the family cycle of addiction can be broken. Such a powerful story, and that's just one of so many. We serve tens of thousands of people annually, and I'm just honored to be able to share her story with you today.
Thank you for sharing. And when I was reading through this the other day before our talk, I mean, it just brought tears to my eyes, especially the part about her losing custody of her kids. And it seems so hopeless at that point, but this is just evidence that recovery is possible. I mean, all it takes is, she wanted to multiple times, but it took her making that decision, but you guys were there to catch her and work with her all the way through her finances. I mean, even helping her get her credit score up and get a car. So, I mean, I think this is so incredible, and what a great story. I mean, we could just end the talk right now. But thank you so much for sharing, and for her, Natalie, for sharing that story with us. So
Absolutely.
thank you. What is next on the horizon for Viewpoint Health? You guys are already killing it. You've got your hands full, but is there anything like we can look forward to that you guys are bringing in that's new?
Absolutely. So we are always looking at how to move forward and meet the needs and the demands, which are high. We've got really, really high demands and high expectations as a safety net provider. One of the things that we've got coming online here really soon is a detox center. So in the client story, you heard about Grand Recovery, and then down the hill is the substance abuse residential apartments, which is independent living apartments. But we're adding to that campus an 8-bed detox unit. So this is going to be 8 individual rooms where individuals can come in and detox for a few days. And then if they're ready and they're willing and they need Grand Recovery, they can just walk right over to Grand and stay there as well, and then potentially move into the apartment. So we've got that full continuum and community for recovery there. We currently detox at our adult crisis stabilization unit. About 20% of our admissions are detox. And so by allowing these other beds to come online, that's going to enable some additional capacity at our adult crisis unit, which is already pretty maxed out. It's only a 23-bed unit, and it's meant to serve all 3 counties.
We're going to switch focus a little bit and go to you as a leader. Workplace culture is a very important topic today. How do you ensure that that's healthy there at Viewpoint Health?
Well, it's something that's always on my mind because we have over 650 employees. If we were fully staffed, we would have more than that, but we've got a lot of vacancies right now, unfortunately. But that's something that's always on our mind. And we go about it in a couple different ways. First of all, we elicit feedback. So we conduct an organizational climate survey on a regular basis. And then we analyze that feedback and the comments that we receive from our team members, and we build that feedback into our strategic plan. We use that to build on our plan. But some of the highest rated scores that we have among and we also share all the feedback with our team members so that they know that you know how you answered it, but how does the whole organization see the organization? But some of the highest rated feedback is that my work is interesting. There's a link between the work that the individual does and our organizational mission and objectives. The ones that I really like is that the team members help me and my coworkers treat me with respect. Yes. So we really have, we try really hard to create a mutually respectful environment, and we really operate with a lot of transparency. Yes. So as the CEO and as a CEO that grew up in the organization, transparency is really important to me. Yes. So I try to communicate consistently and frequently with our team members. So it's usually every Friday. Sometimes I miss a Friday here and there, but I send out an email just with some highlights of what's going on in the organization. We call it Staying Connected. It's not, we've thought about turning it into a newsletter, but I really like doing it just as a personal email from me because I get replies back, I get questions back, I get comments back. And so I really like just keeping it at that level. And then we also host like monthly or bi-monthly conversation and connections. And this is something that we do via Zoom. This is something that we've only done in the last 3 years now that we're all Zoom experts. But we offer this conversation just where I schedule out a day and a time. Sometimes we have a topic, sometimes we don't, but team members are encouraged to log on and have a conversation. If you don't like something that we just did, you can voice that there. If you've got a question about something that's coming up or a change that was made, this is an opportunity to have that discussion. So the last one we did our vision for the next fiscal year, and just kind of talked about changes that were coming up, and try to explain the why behind the changes. I feel like people can get behind you with a
Yes.
change if they really understand the purpose behind it.
People are starting to take a more active role in who they work for and why, and to bring their human selves to work. So they really need to see that transparency coming from the higher ups, and to feel like they are in it together and they're a part of it. So I really love that you're taking that stance and you're doing it. It's fantastic. So as CEO, what are your goals for Viewpoint Health right now?
Well, healthcare is changing. I'm sure you have noticed that hospitals are merging, they're buying one another, healthcare is getting bigger. Like bigger is better in healthcare right now. And as a local community service board, I really have to be cognizant of how to, because even though we're a community service board and we have state contracts to serve individuals that are low income or uninsured, we're still a healthcare provider.
Right.
And so we have to pay close attention to the healthcare landscape and the movement that is happening nationwide for community-based mental health centers is a new payment type, a new payment model, and a new provider type. And it's called Certified Community Behavioral Health Clinic. This is a federal definition similar to a federally qualified health center. And this has been around since 2015. We do not have any in Georgia yet, but Viewpoint Health is moving in this direction along with the rest of the community service board safety net in the state to become certified community behavioral health centers. And this is a different way of providing services. It's a different way of demonstrating value and reimbursement, but we truly believe that this is going to be transformative for the behavioral health system and improve overall health outcomes of our communities. And the reason that we believe this is because the other states that have done it are showing that it's working. And it really works by getting people to care earlier and more preventative services and more proactive engagement at the front end, as opposed to always working on the back end in crisis. So we're really hoping to move those services more upstream where we can have an intervention earlier.
What's your greatest need right now at Viewpoint Health, and how can community leaders support you?
Good grief. My greatest need is staff. I need licensed clinicians. We need registered nurses. We need staff. We were already in a staffing shortage. You know, it wasn't a crisis, but it was a staffing shortage. And when COVID hit, for like the first 6 or 8 months, we were doing okay. And then we just are really, really struggling with bringing on staff. The workforce really shifted. And as you said, I think a lot of people started reevaluating who they work for and their work-life balance and how they work. And so we've really struggled with not being able to fill our positions. However, we really do offer that sense of purpose.
Right.
I mean, just think back to the client story I shared, like who doesn't want to be a part of somebody's recovery? Right. So we've got a great culture. And we've got a lot of flexibility now that we can do kind of some hybrid with telehealth and with in-person. So, but we really need clinicians. So if you're in the community, you're listening to this, you know somebody who maybe is graduating with a degree in psychology or social work, send them my way. We've got a robust internship program. We provide continuing education and free supervision. We've got great opportunities here, but that's what I really need. I need team members.
So we will definitely post that link to your careers page in the email going out with this. I'll also put it in the video description. I also heard Jennifer say great benefits. So, I mean, who would not want to work for Jennifer and doing this amazing, incredible work? I mean, I'm sold. Sorry, Lisa, I'm coming to work for y'all.
Yeah, we do have, I didn't even say about the benefits. It's really unheard of. It's a small part of why I've been here for 20 years, but Viewpoint Health pays into a retirement plan for all of our full-time employees. So regardless, it's not a matching plan, but we put 7.5% on top of your salary into a 401a. So I don't think you can get that deal anywhere else. Plus, it's great work to do.
That's awesome. Well, thank you so much for sharing. We'll definitely promote that on all of our channels. I mean, what a great place to work, doing an amazing thing. So we are all out of time for today. Thank you so much, Jennifer, for spending some time with me this afternoon, giving our audience the chance to get to know you a little bit better and more about this incredible resource, Viewpoint Health. I mean, who knew? This is so incredible. To learn more about what they do, go to myviewpointhealth.org. I'll also include the link to that and some of their social media channels in the video description. Thank you guys so much for watching. We'll see you on the next episode of Lead Up.